I get that question a lot about what we're looking for in residents, and I think the simple answer is someone who wants to learn and be the best surgeon that they can be. And I know that sounds a little bit sort of, I don't know, maybe oversimplified, but really that's what it takes to be a great surgeon, right? Someone who wants to learn, who is always willing to learn.
Things that are common about the residents here at Tulane is a sense of commitment and dedication to taking care of this unique and at-need patient population we have in New Orleans, and a group of people who really enjoy going to work and working together and being part of a team. There's no cookie cutter mold of someone we're looking for.
I think the most important characteristics for a resident to fit here at Tulane Surgery is being a team player, being able to adapt quickly, and also knowing how to just make the best of every situation and have a good time.
So living in New Orleans as a surgery resident, I think is kind of a unique opportunity. Surgery residency, wherever you do it in the United States, is going to be hard. There's no way around it. The amount of knowledge you have to acquire, the hours you're going to work, the complex emotional situations you're going to be in. I think what is really valuable is when you're not at work, being in an environment where you can separate yourself from being a doctor. And New Orleans is great for that.
We're lucky in New Orleans to have a really diverse patient population who don't have access to healthcare readily and aren't necessarily the most educated or the most wealthy. So it really helps us learn how to take care of those patients and their different pathologies.
What I like about living in New Orleans the best is the people. I came to New Orleans and Tulane because everyone here is so friendly, outgoing, different cultures, the diversity, all of that really spoke to me.
Personally, I feel like the exposure that I've gotten to a wide variety of different surgical conditions and a patient population that is in great need of care has also enhanced my training and really prepared me for my next steps.
My favorite experience from intern year was one weekend I was rounding and an appendicitis case came in. I walked in and the chief handed me the instruments, and that's how I did my first appy. He was super safe, asked me all the steps, made sure I knew what I was doing. It was very unexpected and very exciting.
So I think another great aspect of the residency is the size. 5 residents a year, it's a big enough program that you're going to have a lot of colleagues you can learn from, interact with. At the same time, it's also a small enough number that it allows us to really give each resident individualized training.
The relationship amongst the residents is like a big family, honestly. I can call on any of my chiefs, my co-interns, and anyone in between on, help with things. As an intern, there's a lot to have to digest and go through, and so it's nice to be comfortable, asking people that have been here for a while for some help.
The relationship and the camaraderie between these residents, I had never, ever seen anything like it. Like the 2 most different residents in our department, if one of them needed something from the other, they'd be there in a second, no doubt.
We all just have each other's backs, and what makes it special here is because we're all actually friends inside and out of work.
We really value our residents' wellness. Some of the things that we've done to make this a huge part of our wellness program is encourage them to take a half day off a month for their wellness. And this is a time where the residents can use this opportunity to make doctor's appointments, dentist appointments, oil changes, anything that really helps them take some time away from their clinical duties to take care of things that are going on in their real life.
I think the program does a great job of highlighting wellness through our half-day wellness that we get a month. And then we also have monthly wellness events as well, where you get to hang out with faculty, staff, and residents and really get to focus on something else besides medicine.
The best wellness event that I feel like we've done was something last year where the entire residency got together and we did yoga outside at one of our favorite breweries, and it was just a really nice time because it was closed off all for us, so we were the only ones there. And then afterwards we took trolleys out to a park where we were overlooking Mississippi River, and there was just drinks and snacks, and family could come, and other friends came and hung out with us, and it was just a nice day to be casual and relax with everyone and just kind of check in and hang out.
Their annual wellness retreat is held in usually May, and we use this time for the residents to be excused from their clinical duties and to take some time to really gather together and celebrate the year and then do some sort of wellness activity.
Resident voices are actually heard very loud and clear within the program. I think that we have a very open line of communication all the way up to the program director, even to the chair of surgery, who are very invested in understanding what our needs are and what our concerns are.
You know, I think residents are really sort of at the forefront of shaping the program here at Tulane. The administration and all the staff involved in that really do a great job of asking residents for their feedback and having them at the meetings where all these critical decisions are made.
Being a surgery resident at Tulane is honestly one of the best things that I've ever done. Tulane was my #1 choice because, you know, everybody was so nice and caring and encouraging. Everybody was so supportive. Everybody here is always looking out for everyone else. And it's just like a really cohesive environment, like a place where I just feel like I'm allowed to ask questions, I'm allowed to learn, and I'm allowed to kind of push myself in different ways. And everyone here is always willing to support everyone else.
So one of the great things about coming here to train at Tulane is the opportunities you'll get for what comes next. And just the last few years, we've matched people into competitive fellowships in plastic surgery, and vascular surgery, and transplant surgery. And we've also sent people out to do private practice general surgery.
For me, it was really special to stay here in New Orleans because I'm Vietnamese and I'm from the Gulf Coast. So it was really important for me to stay local to try to learn how to give back to my community.
This, I think, is one of the best training places if you really want to learn how to operate and have critical thinking skills and great judgment.